So we're talking about Jazmine's treatment, and what we did is she had a chronic TMJ pain since she was 14. Her jaw was locking up. She couldn't open her mouth or it would get stuck. And also she had bilateral crossbite with an underbite, and she had a lot of airway issues. So what we did is we did a MARPI appliance, which is maxillary assisted rapid palatal expansion. She was an amazing patient. She actually did all the turns how it's supposed to. We waited for that suture, for a little gap to open up, and then we opened up the gap, and immediately she saw or felt a release in her TMJ, and also felt a lot more comfortable. But in addition, as we found out, as we're expanding the upper jaw, she's getting what we call a zygomatic bone. It's actually going forward. She's getting a little bit of mid-face change. And you know, her face looks much more proportional, so her smile got much wider, so it looks amazing now. So what we're doing today is we're actually taking that MARPI device out, which is a little bit of an uncomfortable, procedure, but because it has 4 little mini screws that are holding on each side of the suture. Basically what we're trying to do is recreate the normal development of when she was a teenager and her face grew and she never got that fixed. The upper jaw didn't grow down and forward. So when we take it out, we already achieved that little downward movements. We got the expansion, we improved the airway, and then eventually we'll try to get rid of all of the TMJ problems. So today we're going to take the whole expansion device out and all of the mini screws.
So we're going to unscrew 4 of those screws and then we'll remove the appliance later.
How are you doing? You feel like you have a whole new airport in your life, right? You have another floor.
I have to relearn my speech.
But you have a lot more space now. So this thing came out very good. See, almost no blood. You did a great job.
My jaw doesn't lock open. So at this point it's still getting stuck a tiny bit, but it's no longer getting, like I would have to force it back down. It would lock completely open. It doesn't do that anymore. And also everyone around me has noticed physically a change, like a widening of my cheekbone and my upper jaw coming forward. That's the most noticeable thing. And then I now sleep way better. I didn't even realize that I had poor sleep. But yeah, it's been pretty great.